because difficult to follow two big small words. Easy in the sense that they have almost covered everything that I'm going to talk. There's nothing new you're going to get from my side. I must thank the organizers for asking me to come and give this talk. And being from Kokilaben Hospital, a warm welcome to all of you to this hospital. I've been associated with this hospital for the last 15 years. So warm welcome to all of you. So just going through in short risk factors for pre-diabetes. As I said, most of it will be covered, so there's only going to be nice slides. So some fat people, some thin people. Even that has been covered in the last talk. So just to start off, we all know what pre-diabetes is. We've just heard there are cutoffs, but simple language comes before type 2 diabetes. As we said, blood glucose level is higher than normal, but not yet diabetes. This is what a patient tells us, Patients, what do they say? Not pre-diabetes, borderline hair issue. Sugar is borderline. So I just say, being from the north, I said, yes, it's reached the Wagah border, it's slowly going to get into Pakistan, and then into Afghanistan. So, then they say, oh yes. Then I said, well, you will come back after 2 years, you will be Gokul diabetes. So you have pre-diabetes, and majority of them people don't know. We all have talked, the first two speakers have already talked about this cutoffs, and I'm not going to go through the same. As you all know, fasting glucose about 126, and HbA1c above more than 6.5. One important thing here is that we said standardization of HbA1c. I just said from my experience recently, yesterday I saw a patient from a lab where the HbA1c was quoted as 9% being normal. So just be careful with the labs you're organizing, where you're ordering from. So there's a problem with standardization of HbA1c. So be very careful whom you're asking, which lab you're asking to be sent. Surprisingly, at least for the blood glucose levels, it's the same 100 and less than 100 is normal, and 1 to 126 we talk of pre-diabetes, and above 126 fasting is diabetes, and we talk of impaired glucose or pre-diabetes being less than, if you talk of postprandial being less than 140, and if you're talking fasting between 100 to 125, we just already covered this too. So now coming straight to the risk factors, what are the important risk factors for pre-diabetes and diabetes? Lack of physical activity. Start off with this. I think all of us know that we still are inactive. This is especially increased now because some of us are seeing the COVID. And I tell my patients, please don't work at home. This working from home is obviously less inactive, obesity, diabetes instance much increasing. Now some of the corporates are recognizing this, gone into hybrid mode, and I just heard some of them are now stopping this and asking all the people, all their employees to come back to work. So physical inactivity increases the risk of pre-diabetes and type 2 diabetes. And ADA recommends at least 150 minutes of weekly exercises to combat pre-diabetes. Even unstructured activities such like gardening or running errands can help. And we all know exercise lowers the blood glucose levels and helps maintain weight loss and preventing type 2 diabetes. There's something recent that, what about consistency, or what about if you do fast running or fast walking, and then just a recent study shows that if you do fast walking or running over 3 to 4 miles per hour, it is associated with low risk of developing diabetes as compared to if you're going to do slow walking or even slow walking or slow exercise on a regular basis. That's one, lack of physical activity. Second, family history with diabetes. We all say that most of our patients say, oh, I've got diabetes because my mom has got, my father has got. But there's some contribution. Children with a positive family history of type 2 diabetes are at high risk of developing the diabetes themselves. Recognizing and understanding type 2 related risk factors in these children can help in predict, prevent, and manage diabetes. This is nice studies from the Finnish pediatric group where they looked at children with type 1 diabetes and said, what about their family history? And they found that if there was a first degree relative, these children who developed type 1 diabetes were at an older age group and at a much higher BMI, and they were autoantibody negative. Those whom the grandparents had type 2 diabetes, especially the grandfathers, the index child, again, the age and diagnosis were much higher, and they were obviously more overweight. And those who did not have any family history of diabetes, the age was at no family history of diabetes, the age of diagnosis of type 1 diabetes was much lower and at a lower BMI. So there's some contribution of family history. The other one we know about is the MODY, or the monogenic form of diabetes. That's a single gene mutation, especially MODY and neonatal. Just very basic about this. I mean, if you know autosomal recessive and autosomal dominant, so when both parents are recessive carriers, a child has a 25% probability of developing disease. But if it's autosomal dominant, you have almost a 50% probability of developing diabetes. And that's what MODY is. MODY is an autosomal dominant condition. So genetic factors, it says at least 70 genes have been identified as playing a role in the development of type 2 diabetes, which is a condition that prediabetes can progress into if left untreated. The majority of these genes are involved in insulin production and signaling. Having a family member with type 2 diabetes increases your risk of developing prediabetes. And prediabetes is not directly inherited as such, as other factors are also involved, such as sedentary lifestyle, poor diet. Genetic predisposition alone is not enough and to develop prediabetes, but understanding the genetic component can aid in predicting and managing the disease. So just one component, genetic factors, obviously by itself doesn't contribute, along with other, your sedentary lifestyle, poor diet, obviously high risk of developing diabetes. Then we come to ethnicity. We had the last two talks all talking about ethnicity, your Indo-Chinese, your Asian Americans, your African Americans, they also ethnic groups are at a higher risk of developing prediabetes, and South Asians have a higher prevalence of prediabetes as compared to other groups. We've already heard from previous speakers. And the reason for the increased risk, obviously can be many factors. We talked about visceral adiposity, fat around the waist, but and insulin resistance, they may play a role. So when you have a certain ethnic group, obviously if you know that there's a higher prevalence, obviously means more you need to screen them more frequently and obviously be aggressive in their treatment as well. So ethnic understanding higher prevalence in prediabetes, certain ethnic groups can aid in developing prevention and management strategies. The other thing another important risk factor is cardiovascular, other related factors. Various heart or blood vessel cardiovascular factors are also associated with an increased risk of prediabetes. One of them is being blood pressure, hypertension. It's a common comorbidity in people with prediabetes. Prediabetes increases the risk of developing very important hypertension, and hypertension in turn increases the risk of developing type 2 diabetes. Someone who is hypertensive, please screen for sugar. And the relationship, as I said, is bidirectional. People with prediabetes should be screened regularly for hypertension and vice versa to prevent complications and manage both. And obviously, in terms of treatment-wise, it is lifestyle changes such as regular physical activity, healthy diet, and weight management. So remember hypertension as another important risk factor. Those who got hypertension, please screen for diabetes. Other cardiovascular, other health-related factors include a low level of high-density lipoprotein. That's the good cholesterol, or high levels of the bad cholesterol, LDL. And typically in Indians, we have the high levels of triglycerides in our bloodstream. So diabetes is linked to atherosclerosis and blood vessel disease, which can increase the risk of cardiovascular disease. Typically, low levels of HDL cholesterol and high levels of triglycerides can increase the risk of developing diabetes and cardiovascular. This is particularly seen in our South Asians. So very, very important that someone with this, again, you need to screen for diabetes and vice versa. And these medications would be necessary to control these abnormal lipid levels in addition to lifestyle measures. So remember your low HDL and high triglycerides. The other important risk factor is obesity, which we've already been talking about. This is your BMI cutoffs for the Europeans. We know about, for the Westerners, we know what's for the South Asians. You have a cutoff of 23 and above 27 is being overweight. So obesity is a significant risk factor for developing diabetes. Just losing 5 to 10%, 5% of body weight can significantly reduce the risk of developing diabetes. 5 to 10%, not much. So just 5% also can reduce the risk of developing diabetes. Obesity is associated with low-grade inflammation in the body and impaired metabolic activity, and then this inflammation can lead to insulin resistance, and which is a key factor in the development of prediabetes. So obesity, another important risk factor. Coming to smoking. Cigarette smoking is another factor because of its effect on inflammation and oxidative stress in the body. So oxidative stress can again cause cell damage and lead to insulin resistance and high sugar levels. So quitting smoking is very, very important and essential step, and please tell all the patients to quit smoking. And coming to the alcohol, again another important risk factor. High level alcohol consumption can lead to inflammation in the pancreas, and pancreas is where insulin is being produced and high blood sugar levels and sugars increased. Alcohol consumption can also damage liver. We talked about this, and non-alcoholic fatty liver disease or metabolic associated steatosis and liver dysfunction. So if you are on top of that, you drink alcohol, obviously, your liver is going to certainly get more damaged. It adds extra sugar and starch to the diet when alcohol consumption damages the liver. Moderate alcohol intake is recommended to reduce the risk of complications from alcohol consumption. Ideally, no alcohol, and we don't want any. Worst of all among them is binge drinking, which is almost taking 4 drinks for women in 1 to 2 hours, or 5 for men. So that's the worst as compared to moderate alcohol consumption. Poor sleep, another important factor, risk factor linked to the increased risk of developing pre-diabetes. Chronic inflammation, again, as indicated by high levels of CRP, will explain the link between poor sleep and pre-diabetes. And we know what chronic inflammation again contributes to insulin resistance. How much sleep do we all need? As per the American Academy of the Sleep Medicine Academy as well, they say 7 hours for adults. Obviously, if you're less than 16, you need about 8 hours. And children less than about 10, obviously, would need about 12 to 12 hours or so. So for adults, at least 7 hours at night is what is the international recommendation for sleep. Gestational diabetes, so those women who develop diabetes during pregnancy usually resolves after delivery, but again, having gestational diabetes increases the risk of developing type 2 diabetes in the future for up to 60%. Women who have gestational diabetes should be screened for diabetes regularly, at least every 3 years. We do still get patients who come in after many years after they've had pre-diabetes and they come into full-blown diabetes. They're not checked the sugars in between. PCOS is another very important hormonal condition seen in women and is one of the most common causes of infertility. It is associated with high levels of male hormone androgens, irregularity in periods, and insulin resistance, which can all increase the risk of developing pre-diabetes. And insulin resistance in PCOS can cause high blood sugar levels, leading to pre-diabetes and type 2 diabetes if left untreated. So if you're seeing a patient who's got PCOS, obviously at a high risk of developing pre-diabetes, or if you're seeing a PCOS for the first time, please mention that there's a high risk of developing pre-diabetes. Aggressively weight loss with diet, exercise, and that can prevent this progression to full-blown diabetes. The important thing is stress, which all of our patients will say, I got sugar because I'm very stressed. This is another very common thing. I'm working 12 hours a day. We see this very, one of the 2 things patients say. One is my father got diabetes, so I got diabetes. Second is stress. So stress is a common experience, but people react differently, and managing stress is an essential part of healthy living. And finding ways to address the underlying cause of stress and making time for enjoyment activities can reduce the stress. Anger management is one other very important thing. We're seeing a lot of people getting more angry, especially after post-COVID. So again, I think we've talked about a little of hope. Dr. Joshi talked about yoga, mind-body techniques, meditation. Yoga can be effective in reducing stress. Coming to last few slides, impaired glucose levels in previous testing. So please don't ignore people. One-off reading is high, and borderline, in patients' terminology, borderline or pre-diabetic, they say, okay, that's just one-off test. They forget to test it again, and so this is a very important risk factor that for developing pre-diabetes. In the current era, a lot of people are doing these so-called health checks on a yearly basis, and sometimes just one level is a little high. They say, oh, this was just one-off level, and then this is never checked. And make sure that these patients are regularly followed up. One additional slide I'm introducing here is this is being from the ADA 2024, and they've added this drug-induced hyperglycemia, and so I thought it would be appropriate to put this in as well. Those, especially patients on steroids, which is there's so many of these drugs which we're talking about can cause drug-induced hyperglycemia, such as the fluoroquinolone,
Go to the previous.
Can you see the previous slide? Yeah, the drug one. Yeah.
So such as your fluoroquinolone, that are common antibiotics used. Important protease inhibitors, those are the medicines used for people with HIV. Blood test should be done at the baseline and at least 3 months should be followed up. And second generation antipsychotics, very, very important. A lot of our patients are on these antipsychotics. They should be screened for sugar baseline again at 3 months, then on an annual basis. And among the others, we mentioned antidepressants, beta-adrenergic stimulants, but glucocorticoids, steroids are another important group of drugs which can, steroid in diabetes, which can increase your sugar, and steroid diabetes is more frequently associated, especially with high dose of glucocorticoids. So if patients on steroids should have his sugar check at least at the baseline, it was normal, again at least 3 months, and then maybe at 3 months, and then on an annual basis. So important that remember certain drugs also, is to remember your steroids, remember your second generation antipsychotics, and remember the people on those on HIV drugs as well. So the ADA has devised this new risk score, which is from this new guidelines just published, where it includes 7 questions related to age, sex, race, weight, height, family history of diabetes, history of gestational diabetes, history of hypertension, and physical activity. So the total score ranges from 0 and 11 and represents the risk for developing diabetes. A higher score indicates a higher risk for developing diabetes. So such as how old are you? So less than 40 is 1, 0 point, and 14, 1 point, and so forth. Are you a man? 1 point, and so on. If you're diagnosed with blood pressure, 1 point. So if you scored higher, score 5 or higher, you are at a higher risk of developing diabetes. So that's a very useful score. Very basic things you'll have to add in just your age, your sex, and a little bit of your height and weight as your weight as the last 7 points. So if you score more than 5, then you are at a higher risk for developing diabetes. This is from the new latest 2024 guidelines published by the ADA in the diabetes care. So last 2 slides. What happens if you don't treat? I think that they're going to talk a lot about complications this afternoon, but prediabetes have more cardiovascular disease risk factors than people without prediabetes, and microvascular complications also such as retinopathy and neuropathy. But studies have shown a significant portion of individuals with prediabetes will have these complications, and I think they're going to be discussed more this afternoon. So coming to my conclusion, the last 1 or 2 slides. So in conclusion, you have 2 major, you can divide the risk factors into 2, the non-modifiable and the modifiable. The non-modifiable are the age, gender, genetic factors, ethnicity, and family history. Modifiable, obviously, which you are depending on physical inactivity, obesity, diet, stress, and smoking. So as I showed you a risk score, so you can put all those non-modifiable factors into that and get a risk. And then but certainly your modifiable risk factors of this doesn't tell you the physical inactivity, obesity, diet, stress, and smoking. So to lower your risk, lower your weight, and you will lower your risk for developing prediabetes. That's why I end. Thank you for your attention.